Hi, Dr. Michael Lenz here. I wanted to give a relatively brief overview of pain, in particular central pain or central pain sensitization disorder. Quick overview on pain. There's kind of three broad categories of pain. One has called peripheral pain. That's part of our nervous system and the nerves that take the pain. If we break up our toe, the swelling and pain of that goes up to our brain and processing that as pain. This can be with a herniated disc, or it can be if somebody's got a tumor, it can give pain. Just a couple of examples. Then there's neuropathic pain. Neuropathic means nerve pain. If somebody has a severed nerve or pressure on a nerve, that can cause pain. If somebody has diabetes that's uncontrolled, the blood sugars can attach to the nerves, causing pain. If somebody has something called shingles or herpes zoster, there's inflammation along the nerve from the chickenpox virus that causes inflammation and swelling. Then there's another kind of pain, and this is the majority of my talk, has to do with central pain. Central pain has to do with the internal, from the spinal cord to the brain, processing of pain. What we know under the umbrella of central pain are diseases that include tension headaches, irritable bowel syndrome or functional bowel pain, fibromyalgia, and just to name a couple of pain. Also regional pain syndrome also falls under that umbrella. So what causes this? In one sense, I like to compare it to a thermostat. A thermostat's job in the body is to measure temperature. So there's part of a brain that has to deal with taking many different factors into context. What happens is that when the temperature rises, though, your body and the thermostat hits a certain point, that it tells the air conditioner go on. When the air conditioner goes on, that's in a sense measures the level of pain that somebody's in. When it comes to migraines, people may hit a threshold where they start to get some tension headache, and then they hit another threshold that when they hit that, it starts the fire and the whole migraine starts to take off, for example. So what are the factors that raise the temperature? It's not a figurative temperature, it's only figurative, it's not a literal temperature rise that causes the pain. There's about 4 or 5 factors that are really the majority of what's at stake here. And in no particular order, there's genetics. We know that some people are more prone to pain, and since you have a bell curve of sensitivity to pain, there's a rare number of people who actually don't feel pain. That's one extreme. The other extreme is people will report pain just sitting here. They can be sitting down, doing nothing, and just be uncomfortable. Their butt hurts, their hips hurt, their back hurts. As the table here shows, we have all different levels of sensitivity to pain. Some of us will have very low levels that we're genetically prone to. These can change over time and are affected by other things like stress and other changes over time. Many people with central pain will also be more sensitive to light and sound, where normal people would not have a problem. They might have to wear sunglasses or be very annoyed or uncomfortable around loud noises. So genetics is one factor. Another factor is sleep. If you have poor sleep, meaning poor quality of sleep or not enough sleep, that's a big factor, and we'll get back to that in a second. Now there is exercise. Lack of exercises and lack of regular exercise tends to cause increased levels of pain, and also increased stress causes increased levels of pain. Stress may be skipping meals, stress may be the stresses in life from loss of a loved one, a family member who's sick. If your personal safety was or is being threatened, can be a factor. We know that in fact a large number of people who have central pain at younger ages in life may have had a major life stressor, whether it's a loss of a loved one, a parent at a younger age, or at some point in their life having been through some significant physical or emotional stress or abuse that affected them, causing in a sense some scarring. So we talked about exercise, we talked about stress, we talked about sleeping, we talked about genetics as a factor, and the last factor can be hormones, especially with things like migraine headaches. Having headaches sometimes mid-cycle, but more often premenstrually around that period that increase sensitivity to pain. So what are the ways to treat the pain? Well, if you have a sleep problem, if somebody has obstructive sleep apnea where your throat collapses, treating that, and one way to treat that is through weight loss, but they're also in the meantime, before the weight loss or it can occur, sometimes getting good sleep and getting the sleep apnea treated with something like CPAP or continuous positive airway pressure if that is diagnosed. It just may be keeping a regular sleep schedule as best we can. Also looking to see if somebody has restless leg syndrome. Restless leg syndrome is a syndrome where people have an irresistible urge to have to move their legs, stretch their legs. Accompanied with this is a discomfort in their legs, feeling like a creepy, crawly, tingling, just unpleasant, maybe not necessarily a pain, maybe not necessarily a cramp. When somebody gets up and walks around or moves or stretches, it at least partially helps relieve that urge and that sensation, only to return once somebody sits back down and stops walking around or stops stretching. Majority of people who have this also will have periodic limb movement disorder, where they'll be moving often unconsciously, tossing and turning during the night. Their partner may report that they're like a fish out of water. They just can't get comfortable, toss and turn. The patient, you may report that you just can't get comfortable in bed, that you ache, it's hard to get comfortable, and you usually feel not very rested in the morning and feel very tired and very not doing well. Other medicines that can make a big help with restless leg syndrome, including medications like Requip or Vopinerol, or also Mirapex. Other medicines to help with sleeping and pain include Xanaflex and cyclobenzaprine that can help with sleep and decrease overall pain. When it comes to stress, sometimes there are things you can't control, but as best you can, trying to just simply eating 3 meals a day, eating quality food, 3 meals a day, high fiber, getting rid of the junk, and eating healthy food can help stabilize blood sugar so you don't have the quick rises and drops of blood sugars. It's just a minor example of stress, but all of these little things can raise the temperature. You can't change your genetics, unfortunately, so that part you're stuck with. So we're talking about, and then exercise, trying to get regular exercise can be a factor. Now, you may be in a tough situation where you go, I can't sleep, I can't get comfortable. That's where medication can be helpful. As the diagram here shows, there's many different factors in the pathway of controlling this central pain, as noted. The medications that are often used help deal with these imbalances in neurotransmitters. Tricyclic antidepressants, which are often used in the past for depression, now are mainly used for central pain syndrome problems. Gabapentin, also known as Neurontin. Lyrica, which is a brand name, is similar to gabapentin. There also are norepinephrine and serotonin affecting medications. Duloxetine is one of those, as well as fluoxetine, an older antidepressant. All of these medicines help turn down the temperature, turn down the volume. In a sense, if you're looking at the gain on a stereo system or a speaker system, it turns it down. It doesn't take the pain away, but it makes it hopefully more tolerable that you can function. If you have restless leg syndrome, there's medicines that can affect dopamine, which are often quite effective. It's not uncommon to have a patient who has unknown restless leg syndrome, has just lived with it, has had regular headaches 3 to 4 times, migraines a week. You treat the restless leg syndrome, they sleep better, their energy is better, they can exercise, and overall they feel better, and that makes a difference. If somebody has overlying depression as well, treating the depression, which can coexist, is also very important. One of the other factors when it comes, it's getting back then to regular exercise. Looking at opioid medications like morphine or Oxycontin, it's actually by many of the experts been recommended not to be used, as it can actually increase pain. It's not uncommon for the experts to actually not treat with any other medications until the morphine's withdrawn from their system. When that happens, often the pain actually lessens. The following diagram shows the support based on review of the science for each of the non-behavioral therapies, with education, aerobic exercise being at the top of the list, strength training, yoga also being the top, and then as we go towards the bottom, showing less support from the literature. This is Dr. Michael Lenz. I hope this was helpful. It's just a brief overview of a very complicated subject that it's hard to condense down. It could take hours to get into these details, but hopefully gives you a general overview of a very complicated and often very frustrating disease. Looking at fibromyalgia, migraine headaches, tension headaches, irritable bowel syndrome. One last comment, irritable bowel syndrome. Diet can make a difference. Avoiding dairy and animal protein can make a big difference. Sometimes acidophilus, it's questionable if that's going to be helping. Regular exercise. I hope this has been helpful on your battle with this often very tough and difficult disease. If you have any questions, please feel free to make an appointment.